Hello friends, we all know what diabetes is, and having known what diabetes is, it comes to our mind daily when we listen to type 1, type 2, secondary. What are the types of diabetes that are prevalent? I think it's very imperative to know what are the types in various forms. The diabetes for all practical purposes could be divided into three types: type 1, type 2 and the secondary diabetes. The type 1 diabetes is actually insulin dependent diabetes. Insulin dependent diabetes means the pancreas has actually failed to produce insulin, whereby there is absolute deficiency of insulin, and which can only be treated by insulin and insulin alone. This subset of diabetes actually is about 5% of our population, so very little, and it's usually prevalent in young people, children and adolescent. The normal type of diabetes that we see day in day out, which actually comprises the major chunk of diabetes, 95% of diabetics that we see are type 2 diabetics. Well, then the things comes, why do type 2 diabetics take insulin? So that means they are also insulin dependent? No. Type 2 dependent diabetes is actually insulin resistance or insulin failure due to beta cell failure, inability of pancreas to produce insulin. Not adequate insulin is produced, usually present in elderly people due to gradual degeneration of the pancreas and inability to produce insulin. All diabetics as a progression of the disease will finally land up in insulin deficiency and would at a point of time require insulin. So this is where we differentiate type 1 and type 2 diabetes, where type 1 diabetes insulin is started up front, and type 2 you have to use it at a point of time later in the course of disease. The other third type of diabetes, which we see about 5 or 6%, is the gestational diabetes that we see in pregnancy. Well, in that you see sometimes sugars are elevated, which is usually a transient phase, and that usually passes off with good treatment and a healthy child. And the moment the child is out, you're off insulin, and probably if you consider a good amount of lifestyle, you're out of diabetes. And the other type of diabetes which we see is secondary diabetes due to certain drugs like steroids. So this is again also transient, and once the steroid use are withdrawn, diabetes wanes off. Thank you.